Hello, friends, colleagues, former clients, and patients. This is Dr. Drew Edwards. For those of you who haven't seen me in a while, you'll notice I'm wearing my hair differently these days. And many of you have texted me or emailed me or tracked me down and wondered where I am and what I've been doing. So I made a short video to update you on my life and my career. I am still helping people with addictive disease and their families and loved ones because it's a horrible thing. And I'm about to start a podcast on why marijuana shouldn't be legalized in Florida. So stay tuned for that. I do have the facts and the science on my side. So if you want to be educated, stay tuned. As many of you know, after I left the Pathway Center at Methodist Hospital, managed care gave us all kinds of fits. I was recruited by Dr. Mark Gold at the University of Florida, my friend and mentor and colleague, and I became the Associate Director of Psychiatry and helped put together the Division of Addiction Medicine and worked with some outstanding physicians, psychologists, well-trained in addiction medicine to put this team together. In addition, my faculty appointment included training medical residents in psychiatry and postdoctoral fellows in the evaluation and treatment of addictive disease. Not only drugs and alcohol, but things like obesity, which in many people is a brain disorder. Gambling, compulsive gambling ruins lives just as much as crack cocaine does. Sexual addiction is becoming widespread and more prevalent now. So I was very fortunate to work with Dr. Gold, who, by the way, became the chairman and the 17th eminent scholar in the history of the University of Florida, which has been around for over 100 years. And so proud of my friend for becoming the 17th eminent scholar. And he has published over 1,000 articles and is considered the world's authority on addictive disease. So that was a great time. Some of you know that I got injured a few years ago and had some serious back problems and had a botched back surgery. And a lot of that is better now. And thank you for your prayers and your thoughts on that. In addition to working with Dr. Gold, he introduced me to the whole world of neuroscience. And I began co-authoring papers, academic and scientific papers with him, and we published them. And not only in medical journals and scientific journals, but in layman or mid-professional journals for people who were counselors and therapists. And our goal was to really elucidate the genetic and epigenetic contributions, neuroadaptations, and the pathological changes that affect the brain. We are learning so much about the brain. So the bottom line from my years with Dr. Gold, who we still write some things together, that addiction is a severe, life-threatening neurobiological disease, but until now, which I'm going to tell you about, nobody was treating the brain. And there's been some research that's come out that said the brain doesn't start healing until 3 to 6 months after you complete a 30, 40-day inpatient treatment program. So that the disease is progressive, it's chronic, you have it, you'll never not have it, and we're still working at it. But the cool thing is, about 4 years ago, I met Dr. Sean Orr, who was an interventional neurologist, which means he was trained not only to find a blood clot or an aneurysm in your brain, but most neurologists would just tell you to get your affairs in order because there is nothing they can do. Well, he was one of the first 5 people in the world that would go into your brain, much like the procedure when they go into your heart and put a stent in. but they go into your brain, into these very small vessels, remove the blood clot, and save your life. Now, if they hadn't have done that, there would have been a catastrophic event, usually resulting in death or very little brain function and paralysis. Dr. Orr was also the neurologist for the Jaguars for several years, and he's treated many people with traumatic brain injury. And we still treat a lot of ex-NFL players would have traumatic brain injury or CTE. And there's no such thing as a small concussion. About 5 years ago, I had a traumatic brain injury, and part of the reason why you haven't seen me around, I was lucky I lived. I had what they call a subarachnoid hemorrhage, which has got about an 85% mortality rate when you have one. And I lived, and Dr. Orr really diagnosed it and got me in the right hands of good people, and I'm doing great. I'm currently in a clinical trial run by Yale University, Dr. Gold's alma mater, by the way. And I learned a lot, and we found out that through managed care, so many patients are falling through the cracks and they're not getting properly diagnosed, and they have head injuries and addictions, and those things all kind of run together. So we set out to really do something disruptive. We're no longer married to managed care. We are able to see a patient who calls within 3 days. We will have an MRI if needed and blood work if needed, and you'll be back in the office going over all this stuff with us in less than 10 days. Now, normally it takes you 2 to 3 months to see a specialist. So the fact that around 40% of people currently diagnosed with Alzheimer's disease do not have Alzheimer's disease. Many of them have something called normal pressure hydrocephalus, or, like in my case, post-traumatic hydrocephalus. Whenever you have any blood in the brain, you have an inflammatory response that's over the top. Even without a brain bleed and a series of concussions, you can have a hydrocephalus result. And there hasn't been any good treatment for 60 years other than to drill a hole in your head and put a tube in you. So I'm back, and Dr. Orr and I have started a business called the Neurogenesis Project, and we also have a line of neural supplements that we've developed as neuroscientists that help people, help them with brain rescue, recovery, optimization, meaning getting you back to normal, and even enhancement. If you want to hang on to your cognitive function longer, you can do that. Many of you have kept up to date on this whole anti-aging thing. And what we found is the things that we're doing to create neurogenesis, meaning grow new brain tissue, is what they're doing for anti-aging. We don't want your brain cells to die off. So you've got to exercise, diet, do all that good stuff. So now I've learned how to help treat people with head injury. And the one thing that they don't get is someone who will listen to them. Like chronic pain, when you can't see it, people get real judgy towards someone with this disorder, and particularly with a head injury. You can't really see it, but they feel horrible, just awful. So if anyone that you know is still suffering from addictive disease or a head trauma and does not seem to be getting better, we would love to talk to you. You can call, just like before, you can call me and talk to me for 20 minutes. There's no fee like that. And if I think I can help you or Dr. Orr can help you, we'll tell you what we do, and we'll let you make up your own mind. But it's important that you don't have to suffer with this kind of stuff very much longer. You can see our website at neurogenesisproject.com, or you can call at 904-887-1887, and we'll put that up on here so you can see it. I almost forgot. We opened up a new office right on 3rd Street in Jax Beach just north of JTB. It's a beautiful new office. We'd love for you to come and see it. I guess we'll try to have an open house pretty soon, and I'll try to keep you informed on that. Anyway, I'm back. I'm here. I'm alive and kicking, doing well, and hope to hear from you or see you soon. God bless.